And in the middle of training their staff and their doctors how to do this, a call comes in from the Assistant Minister of Health telling the military major in charge of the facility, quote, "If you value your job, there will be no ozone at Hastings," end quote. We came here that your president's top priority, he told us, was protection of the front line. This was his top priority. And now it's being undermined. All I know is there's been no mention that the man received ozone at all, and we know he did receive it, and we know that he's the only confirmed physician case of a Sierra Leone doctor to have made it. One of the doctors we trained at Hastings, whom I met, got Ebola last week or 10 days ago, and he asked for ozone. He begged for ozone and was refused.
The most tweeted term in 2014 was Ebola. Hi, this is Dr. Mercola helping you take control of your health, and today I am joined for a follow-up interview with Dr. Robert Rowen, an expert in ozone therapy or oxidative therapies, and he is here today to give us an update on his experience and travel to Africa, specifically Sierra Leone and what happened there, so that we can get a better idea and understanding of this therapy as an impact on Ebola. So welcome and thank you for joining us today.
And thank you for having me back, Dr. Mercola. Dr. Howard Robbins and I traveled to Sierra Leone around the third week of October, and it was supported generously by donations from people who just came out of the blue to donate money for materials. The materials we had were syringes, needles, butterfly needles. Longevity Resources from Canada donated 10 ozone machines. And Royal Air Maroc got 37 boxes of cargo on our own plane. Very kind of them to do that.
Wow. Are those machines still in Sierra Leone?
Yes, they are.
Excellent.
They're still there. So we got to Sierra Leone, and we were looked after and housed very graciously by Dr. Kojo Karu, a national hero during their Blood Diamonds era. And the next day, the very first day, we were taken to a large meeting hall where there were probably around 100, maybe even more people there to hear us speak. There were doctors, some extraordinarily skeptical doctors. Now, these are well-trained doctors. They're not U.S.-trained doctors, but they know their stuff. And they came in very skeptical. One was the chairwoman of the Sierra Leone Medical Dental Association, and she was hot to trot. By the time she left, hearing Dr. Robbins and me, she had really melted, and she became friends. And by the end of the week, she actually was receiving treatments from us, and she did a treatment on me to learn how to do it. So we presented our materials. It really wowed the people, but conspicuously absent was the Ministry of Health. They didn't come. And I wasn't made acutely aware of that. So over the next couple of days, Dr. Robbins and I trained a lot of people there how to do this method of ozone, which involves direct intravenous gas administration and the Rowen Robbins protocol for Ebola, which involves a couple supplements and timing of administration of DIV, direct intravenous. Howard had to leave Wednesday evening, and I stayed a couple extra days. So on Thursday, we went out to Hastings, the Sierra Leone government's own Ebola treatment center, expecting to begin treating patients. Now, for the previous 3 days, we were going from meeting to meeting. We met with the president twice. We met with...
This is the president of the country of Sierra Leone?
Yes. Okay. We met with the president of the country 2 times.
And he invited you there originally, is that correct?
Yes. The invitation came from his office.
Okay.
We met with him twice. We were invited to his residence in the evening where he asked us to do a treatment on him. And I gotta say, I really admire him for that, because here he was putting himself in front of all of his people, saying, I'm willing to do this. And he did it, and there was no problem. So we had to go through one meeting after another, and finally we met with Paulo Conte on Wednesday, who is their defense minister and recently appointed their Ebola czar. And after we told him the story, he said, well I said, he has one question for us. Why isn't this being done already? And we just turned, we laughed. We said, we think we need you to ask your other ministers why it isn't being done. So we thought we had clearance now from their top brass, and the next day we go out to Hastings and we start training all of their staff how to do this. And they're asking the right questions too. And in the middle of training their staff and their doctors how to do this, a call comes in from the Assistant Minister of Health telling the military major in charge of the facility, quote, if you value your job, there will be no ozone at Hastings, end quote. Shortly after that, a call came in from the Minister of Health himself reaffirming that. Well, you know, I'm really a fairly calm person under most situations. I'm slow to anger, but I got to tell you, Dr. Mercola, I exploded in full view of everybody there, their whole staff. I just came unglued. I went to the major. I said, you know, as far as I'm concerned, this is an illegal order. It's a crime against humanity. I told the entire staff, you're all at risk. Some of you are going to die. We came here that your president's top priority, he told us, was protection of the front line. This was his top priority. And now it's being undermined. And we've had to wait now with a great deal of pain on our end, and even more pain and horrible human suffering on the Sierra Leoneans' end for a couple months now. I came back around October 24th to 5th. I was placed in 3 weeks of a semi-quarantine. They came out to my house every day to monitor my temperature. They even came to me in Las Vegas on the last 2 days when I was on the podium speaking about ozone at an ACAM conference. And it was funny. While I was on the podium, they came to check my temperature. They did due diligence. And listen, I wasn't actually treating Ebola. I was training the people who would be treating Ebola. Huge difference. So in the meantime, here's what has happened. A doctor, Dr. Khanna, who we trained, and I met at Hastings, sticks himself with an Ebola-infected needle. He is scared to death to get tested. Why might you think he would be scared to death to get tested?
He would be refused ozone therapy.
Yeah. Their policy is if you get tested, first of all, if you're suspected of having Ebola, you're thrown into a room with every other person who's suspected. And if you didn't have Ebola beforehand, you're probably going to have Ebola afterwards. This is what we're finding out now, after the fact. And if you do test positive for Ebola, you're picked up forcibly in a paddy wagon and you're carted off to the, quote, treatment center. Treatment center? Well, I'm finding out now that the people aren't really fed. If their families don't feed them, they don't get fed. At best, they're going to get IV fluids. Thank God for that, at best. And then at best, they have a 60% chance of dying. Or I should say a 60% probability of dying. And in the case of doctors, I'm reading even yesterday that 100% of Sierra Leonean doctors who have gotten Ebola have died, with the exception of 2. The first one is Khanna. Now, we cannot prove that he had Ebola because he wasn't tested. And I certainly now understand why he didn't get tested. He knew he would be carted off and left to die. And I'll have a comment on my own situation with regard to that afterwards. Then Salia gets it. He's another national hero. He's a physician, and our team got to him while he was at Hastings. He had just received convalescent serum and was feeling a bit better. He was considered in fair condition at that point. Our team got to him, and he refused treatment with ozone respectfully. Now, I was really surprised that we were even allowed to get to him to offer ozone, considering what was going on. So he refuses. The next day, he goes into critical condition. He's evacuated to the United States, and then a day and a half after that, he's dead, sadly. And that was a huge loss for Sierra Leone. Dr. Salio was a really good man, I hear. Very caring. He could have stayed in this country. Dr. Carew could be in this country. And Salio chose to live and work in Sierra Leone for the people there. I felt really sad about that. In the meantime, here's more news. Sally's first tests were negative. Everybody was in jubilation, and people embraced him. And in Sierra Leone, you're not allowed to shake hands or touch people for obvious reasons. We didn't even shake hands with the president. We said to him, you know, Mr. President, we have one request if we're successful. He says, what's that? We said, we'd like to be, this was Dr. Robbins actually talking to him, we'd like to be able to come back to Sierra Leone on your invitation and physically shake your hand. And he smiled. That was the only thing we were asking for in all of this. And he smiled and shook his head. And that remains the only thing we requested for this to this day. We gave up 5 weeks of our life for this, including out of the office time and quarantine time. So Mibrewa, Captain Mibrewa, who is a physician, spontaneously hugged Salia after his initial test came back negative. Now, mind you, Sally already had a fever and was symptomatic, but the test was negative, which is not uncommon. So Mibrewa subsequently comes down with Ebola. Confirmed test, positive, symptomatic. We got to him, our team, and he agreed to get ozone. And believe it or not, it was Dr. Khanna who administered his ozone. And I got an email confirming this, and all of this confirmation is by email. Sorry, I don't have anything in writing. I would like to have Mibrewa's name on a piece of paper. But this is pretty well confirmed by multiple sources for us. So Mibrewa gets treated with ozone, and 4 days later, 4 days, the government announces he's free of Ebola. And he actually posts something on his own Facebook page.
Now, did the government's health ministry change their policy and allow it? Because previously they had refused individuals from getting it. I mean, what allowed him to get the ozone?
I don't really know what allowed him. I think Dr. Khanna, who was a Hastings physician, hustled it into the center to treat him. I'm not really sure how it got there or if they looked the other way because he was a military physician. But even though he was treated with ozone, the government didn't acknowledge it publicly. In fact, while they publicly said, we now have a Sierra Leonean physician who's survived Ebola, they didn't tell the world that he got ozone. And the government itself apparently took the credit for it. Now, I said apparently because I don't know everything that happened there. All I know is there's been no mention that the man received ozone at all, and we know he did receive it, and we know that he's the only confirmed physician case of a Sierra Leone doctor to have made it. Now, there's another thing to think about Dr. Mercola. There is a difference between surviving Ebola and being cured of Ebola. And I hope your viewers understand the difference. If I get Ebola and I go into critical condition with bleeding and hemorrhaging and kidneys shut down, and I manage to survive like some of the people have survived in the United States after all of this, I call that a recovery. Would you agree?
Sure.
Now, suppose I get Ebola, I have early symptoms, I have abdominal distress, I have fever, I feel like crap, but I'm not hemorrhaging, I'm not puking, and I'm still eating, and I have a confirmed case, and I get ozone, and in 24 to 48 hours, I'm symptom-free, and I remain symptom-free. Do we call that a recovery, or do we call that a cure?
That's in your definition.
Yeah. Because the natural course of Ebola is, during that 48 hours, everybody is going to go straight down the tube. Everybody. And maybe 40% of the people will recover. Here, within 48 hours, we have 2 doctors who were totally symptom-free and remain symptom-free. In my book, it's a cure. Maybe in the next person's book, it's a recovery. So I don't care. We can call it a recovery, but we can call it an ozone-enhanced recovery.
That's terrific. Now, have you sought to attempt the assistance of the president to collaborate the use of ozone in the physicians who were treated successfully? To acknowledge that the ozone was used? I mean, that would seem to be a good resource since you've already got it in there.
That's true. My only access to the president is one of his advisors, who was the key man who got us over there to begin with. And I have communicated with him by email, and I don't get very much back. I have gotten back an email or 2 saying that the president has directed the Minister of Health now to talk with your team, and I believe this to be true, actually. I can see no reason why this didn't happen. But then we get this email that the Minister of Health has been directed to do it, and there's still no action. And in the meantime, people are dying, and I'm reading on the paper today about all these orphan children, and it's really breaking my heart. Will you adopt me? I saw on the news today.
That's a very sad story. When they've got the solution that would address the majority of the people that have this illness.
Well, I can't sit here with my teeth in my mouth and say that this is absolute 100%. But what I can say is it deserves to be put to a fair test. We now have 1 confirmed case with ozone who recovered in 48 hours, another case, highly suspect, like 98% sure, who also recovered. I can't understand why they're not moving immediately to put this out there, because there's yet another doctor right now who just got infected. And in the meantime...
Is that doctor going to receive ozone therapy?
Well, our team is trying to get to him. And the saddest part of all for me, and I'm talking now as a human being, one of the doctors we trained at Hastings, whom I met, got Ebola last week or 10 days ago. And he asked for ozone. He begged for ozone and was refused. And he was transferred from Hastings, where it could have been accessible, to another center where it wasn't accessible. And then he got renal failure, and he was transferred again for dialysis and died. This is a man that I met and that I had hands-on training with, and my heart is broken because he was refused after he asked for it.
Well, it almost, unless there's an armed guard around you, it almost seemed the best course of action is to sneak out and get your butt over to Hastings and get treatment. I mean, your life's at stake.
Well, even at Hastings, you can't really get it because they're under an order from the Ministry of Health not to do it. For the life of me, I don't understand it. Now, yes, I'm finding out belatedly that there are some protocols that perhaps should have been followed that I, as a foreigner, would have had no way of knowing. Maybe Dr. Carew should have known. But, you know, this came down from the president, just like you said. And it's a national emergency. People are dying. And it seems to me that this is just my human being now talking. They should have bent over backwards to facilitate the hoops that we had to jump through. One of the things that they criticized me for was, this was on national television, National Encounter, well, you didn't come to the Ministry of Health. I said, wait a minute, Dr. Carew invited you to come to our talks and hear the scientific presentation and be prepared for this, and you guys didn't come. And at this point, I now have an email from the Office of the President saying he's directed them to go ahead and move ahead with this, and it hasn't happened. Yes, maybe there are procedures and protocols for treatments that they're not familiar with because Africans are rightly concerned about being experimented upon. They're absolutely right. They're being experimented on with vaccinations, toxic vaccinations, with chemicals, you name it.
So it's a conundrum, and you really made an impact in setting a precedent and establishing that this is an effective therapy for this highly pernicious virus. So congratulations.
Thank you. And in the meantime, we did get to treat Sierra Leoneans for other conditions. I did ozone injections on their knees and on their backs. And on my YouTube channel, which you've posted in the past, you can see I have a file called Sierra Leone Collection of some of their own physicians getting treated and what happens to them, and that they're just amazed at their instant recovery. And I know that that's going on, but so far we're paralyzed in getting to Ebola itself. And now I am believing, this is my own belief, that it's an issue of money, lots of money. I will tell you that the man who was criticizing me on the television, who was a high Ebola official, I was told by the news media that he was earning, this is in Africa, he was earning 110 to 120,000 US a year. So as long as Ebola keeps going on, he's earning as much as the common pediatrician does in this country.
Yeah, so there's many variables or factors that contribute to it not being adopted. Yeah. But let's finish there and go on to some of the other aspects of ozone to sort of recap some of the previous positions. I'm convinced it's a powerful therapy that everyone should have access to for a variety of conditions, not just Ebola. The likelihood of Ebola hitting your neighborhood in a developed world is pretty remote, if not this is not going to happen. So you don't have to worry about that. But there are other infections that you can get, or diseases where infectious component is an illness, like Lyme disease or rheumatoid arthritis or inflammatory bowel disease. So in these types of conditions, it makes a lot of sense to have access to clinicians who can administer this therapy. Or if you want to take it the next step, like I did, actually purchase a unit yourself so you can have it available for yourself, because there are some other indications that it may have some preventive long-term anti-aging benefits. So I'm wondering if you can address those to really open people's eyes to the importance of this therapy as an adjunct, a supplement to it's not a miracle cure-all. It's an adjunct to an important lifestyle changes, but as a supplement, it can have magnificent improvements.
Well, as a supplement, this is how I see ozone. It stimulates your body to do what God designed it to do. We're designed to be self-healing mechanisms. And the bottom line in all healing is oxygen. Are you getting oxygen there? Are you burning the oxygen? Is the oxygen actually making energy? And ozone does all of those things. It improves blood rheology, blood flow, oxygen delivery from red cells. It modulates your immune system so that if you have inflammatory bowel disease, it brings it down to tolerable. If you're infected with Lyme and your immune system is down here, it brings it back up to parity. The work of Dr. Bacci and Cuban researchers have shown this. So to me, it's part of my overall. You know how I eat, Dr. Mercola. I eat a very pristine diet, organic, mostly living foods. So I don't take a lot of supplements because I believe I'm getting most of it in my food, and my testing shows that. But I do take ozone as part of my overall program, and I take it rectally 2 to 3 times a week because I believe it's highly anti-aging, and it keeps up my immune system. And here I flew to Sierra Leone, and when I do get sick these days, it's usually when I travel. And I came back with nothing at all because I was taking ozone there, and when I came back. Then we have to be concerned more realistically, not about Ebola, but about influenza. And we already know that the CDC has said that the current flu vaccine this year is worthless. Flu vaccine's a crapshoot. Well, we don't have avian flu yet, but how long do you think it's going to be before it does come around? It has to. That's what came around in 1918. This is the course of nature. And I really do believe we're not going to get hit with Ebola unless it's a terrorist attack, but we're going to more likely get hit with avian flu, which will spread by aerosol like wildfire. And we do have evidence that oxidation therapies does help this type of thing. That goes back to a 1920 Lancet article by Oliver showing that intravenous hydrogen peroxide cut in half the death rate from influenza and pneumonia in 1920.
Terrific. Yeah, so it's a powerful therapy. I was personal curiosity. One of the more innovative therapies that's been adopted by conventional medicine is fecal transplants in an effort to treat some pernicious diseases like C. diff that can kill you. It's a bowel infection, usually as a secondary to antibiotic abuse. So I'm wondering, in the conditions like that, it would seem that ozone, intrarectal ozone, might be a more effective alternative than a fecal medical transplant. I wonder what your thoughts are on that, or if you had any experience.
I don't have experience with it. Here's my thoughts, though. I think both have value and merit. Ozone's not going to put in the organisms you want. If the organisms aren't there, they're not there. Mm-hmm. That's where a fecal transplant could come into place. But ozone could make it much more habitable and help your immune system assist that transplant to help your body.
Okay, so it might be both benefited or synergistic. Or, now my approach would be a high dose of fermented vegetables and a healthy, clean diet to replant that, because if you have an optimally fermented vegetable, you can get up to 10 trillion, which is 10% of the bacterial concentration in your gut, in 2 ounces of vegetables. So you go through a pint of that, and you essentially repopulate it without the expense or the challenges of a surgical process.
You have had some outstanding articles on your website on that, on fermented vegetables, like sauerkraut. And I hope your readers go back and look at it, because that's one of the best things you can do for your health.
Yeah, I couldn't agree more. It's especially this time of the year as we're filming this, it's getting close to Christmas, which is the winter solstice, and most people don't have access to sun, so you're not getting vitamin D. And if you take oral vitamin D, you need the vitamin K2 produced in optimally fermented foods. So that's a huge balance. So it's just really an important nutrient. So I really appreciate all the updates, and hopefully this will inspire people and convince them that there's value to what we were talking about earlier. And to visit your site, look at your YouTube channel, consider it for some of themselves personally for some of the conditions they may have. Seek out a physician or clinician who can provide this therapy, because it is legal in the United States to provide this. It's not something that's outlawed like in Sierra Leone. What's the best way they can find those resources?
Good resources would be my own website, docrowen.com. I keep a listing of people that I've trained personally. That doesn't mean there aren't other people out there. There are. OxygenHealingTherapies.com also probably has the largest list of people who are doing oxidative therapies. American College for Advancement in Medicine has a listing of hundreds and hundreds of doctors in this country and worldwide. Not all of them do oxidation, but this organization has recently fully embraced oxidation, and I'm their oxidation workshop chairman, and we're teaching a lot of people how to do it. So you probably could find doctors that way as well.
Terrific. Well, it's a magnificent resource. It could literally save your life or someone you love. So it's important to know about it, because you want your tool bag to have really potent, effective therapies that aren't going to kill you with toxic side effects like so many conventional approaches do.
Dr. Mercola, one thing your viewers ought to be aware of too. One of the largest killers in this country, people don't realize it, are NSAID drugs, nonsteroidal anti-inflammatories. Would you agree?
Sure, they're huge.
It's a huge killer of people. Now,
and it does it through kidney disease, liver failure,
GI bleeding.
GI bleeding. Yeah, there's lots of toxicities to them, and then and there's other chronic disabilities aside from death. So
right.
You want to stay away from them.
I haven't had to prescribe NSAID drugs in 20 years. And if you go to my YouTube channel, you'll see people who otherwise came in on NSAID drugs with osteoarthritis or other arthritises and pain, and they leave absolutely in no pain, or it might take several sessions, getting ozone injections. So here's a treatment that is totally, it's safer than aspirin. This is what really gets me about
safer or Tylenol.
Yes.
which is not an NSAID, but used similarly.
Right. And you've done a great job educating your people about Tylenol. These are dangerous drugs, people, very dangerous drugs. And the longer you take them, the harder they are on your system. And the NSAID drugs might reduce your pain today, which they do, but they'll destroy your cartilage tomorrow, because one of their mechanisms is to block enzymes that cartilage cells need to grow. So you can reduce your pain and accelerate your arthritis tomorrow. Now, here we have a therapy that is known to be safer than aspirin, and we can't get it into Sierra Leone to treat Ebola. Yet we are treating it in Sierra Leone. It's not outlawed in Sierra Leone. We just can't get it to Ebola. Okay. But it's being done right now in the form of Prolozone, and your viewers right now could have access to Prolozone and ozone therapies for their chronic pain and aches, and hopefully to reverse their arthritis instead of allowing it to go on. I have people who were told they needed a joint replacement 3 and 4 years ago, and they are better today than they were 3 and 4 years ago.
That's great. Now, for those who are interested, is this approach, is it a local one, or is it a local and systemic too, like major or minor autohemotherapy or intrarectal ozone?
Excellent question. Generally, when you have pain in a joint like a knee or a hip, you treat it locally. If you want additional systemic therapy for other reasons, just to support your body in general, then you can do that as well. Then you can get rectal ozone. I suggest sometimes to my patients to get a machine and do it at home and save money.
Yeah.
And we teach them how to do it. They can get it IV. But if you have pain somewhere, generally it's a local treatment.
And the prolotherapy, is that just ozone injected, or is there something else like Prolocaine? Or Procaine?
Procaine, right. Yeah, the Prolozone involves ozone injection by gas into a joint stings. And it stings for about 60 to 90 seconds, unless you put a local anesthetic in. So we generally put a local anesthetic in. It reduces the pain by well over 90%, maybe even 100%, and you'll just feel a little pressure of the gas. That's the purpose of the Procaine, and we put a little bit of vitamin B12 in, and sometimes some folic acid, and sometimes some other additives to help stimulate the reparative reaction of the body.
Perfect. All right. Well, I really appreciate your time and giving us an update on your travels to Sierra Leone and documenting things.
Okay. Dr. Mercola, thank you very much.
All right. You're welcome.
Bye-bye.